traumatize their knee joint, they do it because of a trauma from the side. You can understand why it might not be trauma from the inside, because your legs stand pretty close together, and it's not likely you're gonna get a medial blow. But you get hit from the side and knocked down, or you fall down, okay? When you fall down on your side, you injure yourself laterally. So lateral blows are far more common. This is what you see in a lot of contact sports, where the person gets kicked or hit on the side, or falls on their knee on the side, ski injuries, all right, that sort of thing. Now what happens when the knee is hit on the side, it bends, goes from, here's a femur, so. Doesn't look right, does it? How do you make it look like a foot?
Look like a hand.
There you
You
go.
can't draw toes.
Just, yep, that's how I draw toes.
Straw shoe.
That's a foot. It's gonna have to do.
Draw
But
shoe.
you push.
It looks better than the last one.
You push on the knee, okay, off of the side. You know what happens? It bends in, right? Now try this. How does this feel? Where does it hurt? It doesn't hurt here, does it? It hurts here. So a medial blow, I'm sorry, a lateral blow goes to medial forces and trauma. So of course, of the two collateral ligaments, the medial collateral ligament is looser. It's the, I'm sorry, the lateral, don't say, poor girl. The lateral collateral is looser now. It's the medial that you've stretched. So of the two of the collateral ligaments, it's the medial that you tear and rupture. Additionally, the cruciate ligaments, now this is a little harder to understand. It's the anterior cruciate that gets injured. Right here, not the posterior. And the reasons that the anterior cruciate tears, it's a little more vertical. If it were more angled, it would have more room for give. But it's straight up and down, so it can't be forced too much without tearing. And it's also very, very firmly tacked down. It's so firmly tacked down to the menisci that it has little room for give. Whereas the posterior cruciate, look at it back there, it's more angled, and it's angled, look at the angle it's at. It's at an angle so that when you hit from the side, it buckles, it has more give, more room. So it's very unlikely you're gonna tear that posterior cruciate. It's also attached at the bottom to the slippery lateral meniscus, and it gives a lot. So the anterior cruciate, because it's rigid, vertical, and tacked down more tightly, is the one that tends to be injured as well. Now also, the medial meniscus. Now you wouldn't think that it would be the medial meniscus that would be damaged at all, but the lateral meniscus over here, thinner, a little looser. So when you put forces on it, which you're absolutely going to do right here. Here it is right here. It shifts very slightly. Okay, so it's very flexible and adaptable. But the medial meniscus over here is very rigid and tacked down, and so any forces on the knee at all cause it to tear and rupture. So these lateral blows end up causing medial traumas. The medial meniscus, the medial collateral, and the anterior cruciate. shoulder joint. Well, talk about